I want to thank everyone who sent in questions for the discussion yesterday with Dr. Lisa Klein of Turning Teen. It was a really great discussion. It was a little chaotic with some technical difficulties, but I wanted to first make sure that everyone understands that it is not medical advice on the Go Long show. Anyone who comes on, it's not a patient-provider relationship. So I just want to keep that in mind, and you should always talk to your own doctor. I'm also going to try and get her to come back on and do something a little bit more structured so that we can get into some more topics. Thanks for tuning in. Thanks for your support of Go Long. However you support us, follow Dr. Lisa Klein at Turning Teen. That is her handle on Instagram, Turning Teen. Follow her and have your kids follow her because she puts some really great content out there. Remember, it's your life. Go the distance, go long, and enjoy the show.
Thank you so much for joining this Instagram Live. It's last minute. We put it together. Dr. Klein just got off of seeing patients all day. I have so many questions from people on different topics. So we're recording this. Why don't you talk about a little bit about your background and, what you do in your clinical practice, but also this other thing that you have going on that's really taken off.
I'm Dr. Lisa Klein. I'm a pediatrician as my real job, as my day job. So I see kids in the office, right, and love it. And I'm the teen queen in the office, as some of my patients like to say. And then I'm also a co-founder of a business called Turning Teen. And we provide educational workshops about puberty, sexual health, parenting, menopause, even now teen skincare, which is a hot topic. So anything adolescent, come my way. You can't scare me. And I'm here to help everybody. So that's what I do.
That's awesome. So bunch of questions that have come in. When is a safe age to start weightlifting? And is creatine safe for teenagers to take? Maybe you have some thoughts on that from your experience.
Sure. So I think puberty is an appropriate time to start weightlifting, not go from 0 to 100 in 2 days, as I think everyone would know. But sometimes we get overexcited, especially young minds, eager, strong bodies, because that is the time, right, that we start having hormones going through our body. And we can first start with your own body weight, and body resistance is a great place to start, and then build yourself up. But why do you see teenage boys seeing such amazing results in the gym when they're young teens? Is because they have testosterone raging through their body. And so they're going to see the best results ever because that's the time that they can do that. Now, we lift weights to feel healthy, to be strong, to help our bone health. So there's lots of reasons throughout life to lift weights, but it's very important especially for anybody, but especially for these young starting out teens, to get instruction and get help and learn their way around a gym and not be so aggressive, to not hurt themselves. Second thing would be supplements, right? Creatine, protein shakes, muscle milk. There's more than I can even imagine. And those I go with extreme caution, right? I think that probably any dietitian, any healthcare professional would tell you to eat the rainbow and eat real food. I don't recommend and typically say that they should be taking creatine. I think a good pure protein powder, pea proteins, whey proteins, okay. I don't like anything that has so many ingredients that you can't read them all and name them all and understand them. I think that's a good way to go. Energy drinks, the Celsius I see people drinking at gyms, caffeinated drinks, no. Healthy habits from the get-go, right? Keep it simple, keep it clean, keep it real, I think is just a good...
Yeah, so I know that for me, in terms of looking for a protein powder, there's this website called Consumer Lab. And they independently test all the major supplements out there. And what's really great about it is that I can access it through my local library here in Seattle. So it may be worth also checking with your local library, if you have a library card, to go and check and say, what are the most pure protein powders out there? Because the other thing that I find with supplements that I think a lot of people don't pay attention to, and Obviously, this is on the menopause side, which is what I do, at the other end of puberty, so to speak. And it's that you don't know how these supplements impact existing medication. So if your kid is on ADHD medication, you don't know how that's going to be impacting the impact of the ADHD medication if you're taking creatine. So that's another thing to take into account, is that when you're thinking about supplements for anybody, if you have what I would call life-saving medication, you want to think about how that's going to work with the supplements. And most supplements aren't third-party tested. And I know you know that, Lisa.
So that's a big deal, right? And there was a study years and years ago about the four most common over-the-counter. They weren't necessarily workout supplements, exercise supplements, but things like St. John's wort and all these things people were taking, and they tested them from like big companies that were selling them, right? So it was like Whole Foods and Target and a couple other places. And what they found was, because they're not FDA regulated, and even then that doesn't make it perfect, but they found they were grass, or they were all these things like they didn't even have in it what they claimed. And that's fine, right? Especially if it's grass, it could be harmless, but it's super important if you are getting care for other things or taking other medications. And that's what pharmacists also can be helpful for. I think people forget to ask their pharmacist, hey, what about this drug interaction? How is this metabolized? Is this going to increase, decrease the metabolism of a certain supplement with this drug? Pharmacists are extremely knowledgeable people to help with things like that.
I feel like things just keep escalating in terms of like how much training is out there, specializing so early, on the repetitive use injuries really soon. One parent asked, how much is too much running per week for their teenager? Their teenager is super duper into cross country. They want to just keep running. And I know there's also a difference between there's mileage, but then there's also how long it takes for you to do a run. It's almost like effort versus duration, where it's okay, I can run 6 miles, but so how long it takes me to run 6 miles versus how long it may take a kid to run 6 miles are probably very different. So how do you have those conversations with parents to make sure that there's pushing yourself, but then to something dangerous?
I know this is trying to just give broad statements, but and I know you are excellent about saying consult your physician, consult your medical team, right? Because everyone has their own individual. I think a good way to answer this question is that it's multifactorial, meaning how's your weight? How's your fuel? How's your nutrition? Have you adjusted that for the amount of exercise you're doing? How do you feel? How does your body feel? How are you sleeping? How's your aches and pains? Obviously, the kid coming into me with shin splints and is in so much pain, I'm going to have a different answer for, or the patients that I see that have a history of an eating disorder that are getting back into exercise, right? Way more cautious. There's just so many different elements. Are they healthy about it in the mindset, or are they becoming like exercise obsessed? Because you get that amazing feeling, but there's a fine point. What's their family history and their cardiac history? So there's a lot. What else are they doing? Oh, okay, you're running on your own, but you're also training with the basketball team and the cheer team. How many workouts a day are you doing? But there can only be so many hours a day. I'm going to talk about young people because I'm a pediatrician. Okay. Yeah. And I'm not the cardiologist for competitive ultra marathoner who's in the 40s. So I can't go there. I got to stay in my lane here. No pun intended. But
literally, I have a client where they're worried about, I told them I was doing this IG Live, and they said, ask them about this because their son he's getting all these messages around bulking up and losing weight and all this really dangerous kind of language.
Yes, and that is exactly what I call that. Dangerous trigger word language for me, whether you're football player, dancer, wrestler, right? And I understand these are sports. I understand competition. I was a high school athlete. I have kids that are athletic, each in their own way. And I think a big part of it is obviously as a pediatrician, not just talking to the parent, but talking to the kid. Where is your mind at? What is our goal? what is the why? Because that's huge. My coach said I have to, or I have this goal and I want to try to achieve to run X amount of miles. And yep, when I wake up early, I'm going to bed earlier. And when I'm running this extra, however much on the weekend, I'm fueling this much extra. Oh, you have a resource for a dietitian or a trainer or sports medicine doc for me? I'm interested because I'm interested in being the healthiest and the best I can be versus the person who's giving you the information that, oh, I'm making myself do this. And if I don't do this, I don't feel right. And I'm trying to get to this goal weight and that. It's just such a different conversation. So I think you appreciate this, knowing who you are. It starts in the mind. Like, where are we at? Why are we doing this? What's our goal? And how can we do this healthy?
Okay, that's great. So continuing on that, how do you encourage healthy eating? So not every kid is a fit for sports, right? But how can you encourage healthy eating and exercise for a kid who just, the sports scene isn't their thing?
I love this question because I did this today with a 10 or 11-year-old male in the office. I do this all the time. And I raised two very different boys, two very, very different kids, right? And one, my oldest, I don't think you would mind me talking about him because everyone knows he's a theater kid and a dancer, which is very athletic. And just singing and moving around on the stage is a ton of cardiovascular work. And we learned that quickly, right? He was our first. We put him in all these sports, soccer, baseball teams, and all this stuff. And we're like, yeah, that didn't stick. Nope, he doesn't like that. And so he loves music. So we found other ways to move our bodies and have dance parties and then end up formal training in dance and theater. Amazing way to move our body. And my second, right? Every team sport you can fathom. Can't get enough of it. In high school athletics now, right? And the kid I saw in the office today, the parents are like, we found karate, like martial arts. What a great way to move our body. And this kid didn't mind swimming, right? He doesn't look, in quotes, everybody, like your traditional swimmer, right? But he enjoys it. Okay, he doesn't need to be Michael Phelps, right? Or the latest Olympians. I got to learn all their names. So we have to introduce. So the answer to that is introduce your child to a multitude of sports. You don't know what's going to stick. It could be golf, and instead of golf carting your way hole to hole, carry your bag. It could be taking walks regularly as a family. It could be bike riding. It could be crew. It could be kayaking. It depends where you live. It could be snowshoeing. I remember I wasn't a downhill skier kid living in Michigan, but my mom loved to go cross-country skiing. So it's like probably not the most common form of exercise for a tween or teen. My mom and I all the time would go cross-country skiing growing up. Amazing exercise, right? But might not be a sport at your high school. But
I think that the other thing that you brought up is really good is the theater part, because my niece is definitely a dance kid, and the amount of cardiovascular system that you're using in there is pretty insane. And it's very underrated in terms of being an athlete. I love that you brought that up because it's like theater kids can be very athletic as well. We just don't look at it like that. So
try singing.
I heard Taylor dance. She does her playlist on a treadmill. Like she actually does that.
You have to. It's unbelievable the amount of cardiovascular and pulmonary effort it takes for singing and dancing at the same time. And then you asked about fuel. You asked about eating, healthy eating. Listen, we can be healthy at every size. We don't all have to look the same way. Like I don't think a certain look means healthy. Right? I'm sure those of us tuning in feel that way. And I purposely, like when I'm doing a checkup in the office, right? You're physical. I purposely ask all the questions about how's school? What are you doing? What are your hobbies? Okay. Then I go into movement, and then I say, let's talk about fuel. I just use that word. What kind of fuel do you put in your body to make you feel good, to give you energy for all the things you like and to stay awake at class? Because we don't want to have good foods, bad foods. We don't want just rewards. We can have fun foods, right? We can have fun foods that are like treats, fun foods on our birthday. We don't want to. And then at the very end, the point is at the end of the visit, I'll be like, let's see how much you grew. And we'll talk about our height because kids want to know if they grew taller. But I try not to even give a number. Yeah. I try not to say the weight. So why do I weigh them? Especially in growing, developing children, weight it's a vital sign and it's important. But if I have somebody either who's having an eating disorder issue, right, find weights, don't look at the scale, you don't need to know anything. Or if I have somebody that says, not my thing, I'm like, yep, it's just a measure of gravity. And let's figure out a way to get it without talking about it. And we just don't focus on the number. So right? We just have to focus on fuel to feel good.
So when do you say, maybe you make a referral to a dietitian? When is that an appropriate thing where you're like, you know what, I think this child may need some more specialized help?
To a dietitian and bring that up a lot. One, normalize it, that it doesn't always have to be for a diet or for weight loss. But it could be, oh, you're working, like I love saying, oh, you're working out more. Oh, you're playing a new sport. Why don't you talk to somebody that understands food, knows what goes great with what, how many grams of protein might be healthy for you. Utilize a dietitian. So that's one way to even bring up using a dietitian when you have a weight concern potentially about a kid, but you don't want to refer them to the dietitian because of their weight. Tweak it a little, or for sure, like we say, I recommend to the family. This could be a family project.
That's great
for the family. Let's talk about and small goals, right? So if someone comes in and says, I want to lose weight, what's a great first goal? Just don't gain any. Well, stay the same.
But the other thing is that you can also have a kid, and I went to school with kids with wrestlers trying to hit a certain weight class or even rowers, for example. So there's the other side of the spectrum as well, where it's not about necessarily, quote unquote, losing weight because you're overweight, but you're trying to do a bunch of things to try and make a weight class work. And you're not fueling so that you could perform.
I don't have a great answer for this because I see more of the disaster that comes from that than the success stories and those that it doesn't affect. I'm going to see the ones that are struggling mentally, physically, eating disorder wise from those situations. So I think I have a bit of a biased view. So I don't like that. Thankfully, I'm starting to see in like the dance world, right? It's a big thing for a reason. Stereotypical how the females are supposed to, and even males, right? Male dancers look in leotards and be a certain weight and a certain physique and so many studios, thankfully now, are just really, parents are like, we switched studios. We don't like the vibe there. We don't like the message they're sending the kids. They're not giving them time for appropriate snacks. So the whole weight thing, I don't have a wrestler and I wasn't a wrestler, so I don't want to speak out of turn.
Right.
But that weight class thing, I get it. Like there's supposed to be different classes and things like that, but I don't have great advice on that, but it's to tread very carefully. And if you think red flags are coming up with your kid and trying to lose 6 pounds of sweat by working out in plastic, I've seen that at gyms.
Yeah.
That's not healthy for anybody.
Right.
A growing body.
Right. Let's shift gears a little bit. Let's talk about the fact that puberty seems to be happening a lot earlier than, say, when you and I were hitting puberty. And it was bad then in the sense that your brain was not in line with your hormones back when we were kids going through puberty. But now with kids hitting puberty even earlier, how do you have that conversation? Is there a way you can delay menstruation or anything to wait for things to get in line? And I don't know if that's a thing or not.
Yeah, loaded question that I get asked all the time that I love, and I'll try to dissect it and stop me if you want to, because I have a lot to say. So first of all, a few months ago in 2024, sometime this year. Another new study came out that was a really well done study on female puberty and age of menstruation. And now they've proven that the average age of menarche, which is a fancy word for onset of periods, is 11.9 years old. So 11 and 3/4. So that's an average, right? So that means there's plenty younger and plenty older. It used to be when I started turning teen in 2015, for all these years, the past 8 years, I've been quoting the average age of menarche at 12.5. Okay. And about 50 years before that, it was like 14. So, yes, puberty is happening earlier. On average, you can say the main age range for females to begin showing some sign of puberty can be as young as age 8. Now it's almost 7 3/4 years old for breast buds is legit. And males is always typically later, not studied as aggressively as much. And so they start puberty somewhere between age 10 and 14. And that's start, right? Not finished. Puberty can take 2 to 5 years. So yes, there are 10-year-old females menstruating. There are 4th graders and 5th graders that have their period. And so mentally, you ask me, like, how does that work? The purpose of turning teen, the purpose of my doctor appointments, right? The purpose of a parent or trusted adult connecting with a child is the puberty will happen to you whether you want it to or not. Puberty happens to every single person, okay? And we're not going to stop it medically if you're within that age. So if puberty starts at 8 and someone's going to menstruate at 9.5, 10, 10.5, no one is hormonally getting involved in that. If you're a 6-year-old going through puberty and have precocious puberty, will intervene, and you want to, because it will affect your final adult height.
So then, is there a reason why it keeps shifting? Has there been conclusive reasons why this is happening? Is it the food supply?
The reason that people think, right? Those that I suggest say that it's happening earlier. First of all, if anyone's interested in reading, there's a book called The New Puberty. It was put out probably a few years ago now, written by a pediatric endocrinologist and someone else, so that's very good. So I like it if you like to read that kind of stuff. Okay, multifactorial reasons females are going through puberty younger and earlier. 1, childhood obesity. Okay, foods we eat, how we eat, processed foods, but it's the obesity piece that is definitely causing puberty to happen earlier. Adipose tissue, which is F word, fat tissue, has estrogen-like effects, and definitely contributes to that. Number 2 would be stress level, things like significant stress, low socioeconomic status, poverty, severe stress, broken homes, even things they're saying like like a significant divorce. Yeah. So the lower socioeconomic status, the higher the stress, the worsening the living condition, increased chance of early puberty. And 3 is like environmental, which is a real big topic and a hard one to study because it's very hard to do controlled studies, right? With kind of plastics, BPAs, and pesticides, things in our food. Very tricky to study, hard to say. But let's be real. I'm sure that's part of it. Those are the top 3 that I mentioned when parents say that in the office.
So a question that came in was around this client is their daughter's about to enter puberty, and the mom has had heavy periods, severe cramping, and lived with it too long. And she wants to make sure that she's able to have a conversation with her pediatrician on if there are ways to make that better so that the daughter doesn't have to go through what the mom went through other than going on the pill. So basically, she feels like it's suck it up or go on the pill were the only options that are available. So what would you advise this parent in terms of advocating for her daughter if this situation arises?
So I hope it doesn't happen to her,
Right.
but so firmly believe that we don't have to live in misery. Just like in your space of, right, women 40 plus and turning teen, diving into this turning teen for mom menopause space, we need to advocate for ourselves. So parents need to advocate for their children. I talk in the office, teenagers need to advocate for themselves, right? We don't have to live in misery and suffer. Obviously, if the basics aren't working, like anti-inflammatory NSAIDs, Motrin, there's lots of ways. And again, please speak with your own medical provider. Don't provide individual medical advice over Instagram Live. But I talk with patients about even, okay, once your periods are regular and these are cramps and your period's about to start but hasn't yet, you start taking that Motrin. There's data, you start taking it beforehand to even prevent those cramps from happening. There's natural supplements. Things like magnesium are great for cramping. That's something natural to try.
But
Exercise.
But you should also check and make sure that your magnesium supplement actually contains magnesium.
That's a good start. And the right kind of magnesium, right? Not necessarily one that's going to make you poop more. Exercise, hydration, lifestyle. But yeah, family history for sure can play a role in that. But of course, like a hormone contraceptive pill is definitely still utilized in these circumstances when needed, but it doesn't have to be first line therapy. And if you don't have a doctor, no matter how old you are and what field you're in, that you don't think is hearing you, okay, might not have magic fix, but if you don't feel heard and you don't feel like the attention and the care is there, get another opinion.
Yeah.
You know, that's good. That's you should. It's your body. You only get one.
How would you advise a parent to talk to their kids about puberty?
Yes. You know, my motto at Turning Teen is 8 is great for females and around age 10 for boys. But I don't, first of all, it's not just like one big talk. You want to just always have open door communication. I think utilizing resources like a book. I wrote a book, by the way, on puberty, but it's a chapter book, more for ages 10 and older. I don't care if you buy it. I'm just saying there's a lot of books out there because you don't have the same comfort level, most of you, as I do, saying the words like breasts or vulva and things like that. Very important to start teaching your child from the second they can speak proper names for their body parts. You're already ahead of the game if you're doing that because you're already going to be ahead of the game when you have to talk about puberty, right? We have nipples, we have arms, we have noses, we have private parts, personal parts, and just in case I'm getting censored, I don't have to talk about everything so specific. And then open door policy with the bathroom, right? Or you're buying pads or tampons. What are those for? Oh, a female bleeds once a month. That's a healthy thing her body does. Gradually over time, talking about puberty and using resources and going to the doctor, a pediatrician for an appointment about it. And our bodies change as we get older, and that's normal and that's healthy. And we want that to happen because knowledge is power and knowledge decreases fear.
So quick question. You brought up tampons. Is there like an age where like you could just start using them day one if you need to?
19. We do not say you have to be a certain age to use the tampon. The rules for tampon use says you have to be able to name your body parts down there. Where does the tampon go? It goes in the tunnel that goes inside of our body. That's your vagina. You have to be able to touch your vulva to be able to access your vagina. Okay? So you need to name that, know that, be comfortable touching yourself, and be a responsible person that you're not going to leave a tampon in for 10 hours, 12 hours, whatever, especially if you have a light period. Some of these girls can, right? But we don't want to. You have to be responsible that you're going to say, yep, hey, mom, or hey, trusted adult, I'm ready to use tampons. I'm going to use them. Feel free to remind me, make sure I changed it so I can be safe. But knock yourself out. More power to you if you don't miss any swimming in the summer.
And the next question that came in, what birth control options are appropriate to discuss with my teen? This one person, their daughter asked about options and the pediatrician was less than helpful. And I think this child's like a freshman or a sophomore in college. Even though you're not advising this particular patient, what are birth control options that are, say, appropriate for teens?
Any and all options, in my opinion, because I would rather have a teen who is legally an adult, right, who sounds like needs to seek care from a family medicine doc, a gynecologist, or if this person that I am speaking to right now goes to college somewhere and has access to a student health center, they are more than capable of taking care of this person for their sexual health concerns. Okay? Because we'd rather be on some form of birth control than be pregnant if angle were taken right now. And I will always, of course, when I'm talking about sexual health and sexual activity, always say there should be two, if it's not abstinence, two forms of birth control, right?
Right.
Always be a condom, a barrier method to prevent sexually transmitted infections. And because not all forms of birth control, no form of birth control, if you're sexually active, is 100%. So having two forms, a condom plus something, which typically falls on the female, right?
Yeah.
Is important. I have college kids getting IUDs. I don't put them in. So I do a little counseling about it, but not the extent of counseling that someone that puts them in. Nexplanon, birth control pills, NuvaRings, diaphragms, not common, but there's so many options. Absolutely something. And plenty of people, and Planned Parenthood is still available in many areas, not all, as an option for both female and males to get appropriate sexually transmitted infection testing, birth control counseling, etc. They do a lot of things.
What are the pros and cons for a teenager in terms of taking the pill versus like an IUD? Any considerations to think about?
There's definitely, and again, I don't place IUDs, so I'm competent and knowledgeable, but I don't know if I every answer is somebody that puts them in. But there are certain contraindications, but not that many to hormone contraceptive pills that you always want to screen for in terms of certain type of clotting, bleeding disorders, migraines. There's a family history piece you want to take and a personal medical history always. But very commonly, they can be put on it. The problem with that is you're talking about a college kid or a teenager taking something every single day. So compliance, lifestyle, type A personality or not. Like there's so many things that go into choosing the right one. So I would say that if this person felt unheard by their pediatrician, many pediatricians don't prescribe birth control, okay? More than just, if they do, it's going to probably be the pill. These adults, teens, young adults, whatever, deserve excellent care, deserve all this counseling, deserve a shame-free, non-embarrassing, ask me anything environment, and should find someone that can do that for them.
Okay.
Right? Like I'll see college kids in my office, like if they're sick, but I don't do their physicals anymore.
So I guess the question is that if this person outgrows you, do you send them to like an OBGYN? Do you send them to a primary care physician? If they're...
Yeah, Bob, either one, right? Like you need someone that can help take care of all your needs. So whether that start with the GYN, start with your student health center, go see a doc, an internal medicine doc. There's a ton of internal medicine docs that can do all of your GYN care. Some won't. It's hard to find a female internist for my female patients looking, but I have a few names that I give out of people that I know that can provide comprehensive, awesome mental health care, sexual health care, everything care, right? And sometimes you have to see a few different people for that, and that's okay. And I speak now as somebody with a kid in college, and I talk to my son's friends and what kind of care they get and what the student health centers offer. You wouldn't believe what's in the vending machine in my college son's dorm room. I love it, okay? This is me, though, and I'm different than some other viewers, and that's mine, too. But pregnancy tests and Plan B and condoms, the over-the-counter pill now, the over-the-counter, all in the vending machine in his door.
So that's great. And he goes to college. You don't have to disclose where he goes, but he goes to college in a relatively conservative state. How do you talk to your kids? If you find out your kids are using porn or they come and talk to you about porn, what's a good way to...
So no shaming, okay? Because if you find them watching it, or if they actually come to you and say, I saw something that was pretty wild. Yeah, naked people doing something on YouTube. Thank you for telling me. Or you catch them watching it. Oh, I see that, or you're watching something. This is actually something that's not meant for your eyes. And let's talk about it. And it can be confusing and it can be shocking. And I can understand why you didn't look away because you're like, what am I seeing? Or maybe it's a kid that has watched it a lot, and that's a whole different kind of conversation. Let's talk about why this is unhealthy. Let's talk about how porn is not reality. It's like movie making. It's like when they show that they're running through a volcano, but the actors really aren't running through a volcano. It's all edited. It's all fake, right? And these are models and these are actors, and porn is often, right, violent. And this is not how two people that respect each other and care about each other should treat each other. And the problem is kids are learning sex ed from porn. So when they're in their first sexual experiences, they're being violent to each other because they think that's right. They think that's normal. The girl thinks it's okay to be choked and hurt and slapped, right? Because that's all they've been exposed to. Versus if you preempt all this, start these conversations, have them, because this is the reality we live in. We can say, my kid could give this whole lecture himself as a 16-year-old boy with the amount of times we've talked about porn with him. Because I'm just like, let me explain to you. You and your friends are watching this. Is it real? This isn't how we treat people, etc. There are, again, resources. Thank goodness for technology in the sense that we do have resources.
If you catch your kid masturbating, whether it's the porn or something else, right? Like, how do you have that conversation with the kid to be like, hey, this is normal behavior.
So masturbation is even a little different of a conversation, right?
Right.
Masturbation is self-pleasure. It's normal. It's fine. It's your body. Do what you want with it. But we do that in private. I did tell this to a parent of a 3-year-old today whose kid won't stop touching himself, and he's masturbating at preschool. Okay. So different conversation with a 3-year-old than a 16-year-old, but okay. And how do you talk to your kid about porn? Is you said, you just hit it straight on. Like, people do this. This is an industry. Porn is addictive. It releases dopamine in our brains. So you want to watch it again, and you want to watch it more, and then different kinds, because the regular kind won't excite you. So now you're going to go to the next level, and then you're going to go to the next level because it's an addiction, right? And it's a dopamine release. It's like a drug. And we have to be very careful about, 1, watching things that aren't real, 2, thinking we're learning from these things, and 3, becoming addicted to things because it gives you this I feel good feeling, an excited feeling, an adrenaline, but not healthy.
That's good. All right. So we're going to go to one last topic. It's around stress and social media usage. And so I feel like kids are a lot more stressed out now than when we were kids. I don't think it's a coincidence that social media is a thing that, thank God, wasn't a thing when we were teenagers. How would you recommend in terms of when you see a kid, like, quote unquote, normal stress versus this is unhealthy? What are ways to treat it? And then what's the right limit on social media?
So here's the deal, everybody. Of course, teens and parents are stressed out. But let's talk about kids. I say all the time, you couldn't pay me $1 million to go back and be a kid right now. That's a lot. And we were stressed too, but in a different way, because we were not bombarded with this technology. And I love the movement right now of schools that are saying no phones in school. Hallelujah. They don't belong there. We don't need them. You know where your kid is. That's it. Social media, I talk about all the time. The longer you can wait, the better. The trick is for the parents that are going to be like, well, then my kid's missing out on communication, right? Because some of them do. Like, they communicate via Instagram messaging or Snapchatting and not even via normal texting. But the longer you can wait, the better. They're bombarded with false images, photo-edited images, access to pornography, knowing where everyone is at all times on Snap Maps and location sharing services. And why wasn't I invited to that person's house? And why'd they lie and tell me where they weren't going? And pictures of this and that. And access to strangers. It's awful. And when I counsel about seatbelts and helmets and do you know how to swim for safety, I counsel about technology use and not talking to strangers and not sending naked pictures. The amount of counseling that has to be done in a health visit, let alone that parents have to be on top of and navigate. And we clearly are not as tech savvy as it is a lot. So if you can wait, and just because you allowed it, also, I love to tell this to parents, we are not perfect and we are parenting in a whole new age. Just because you allow something doesn't mean you can't take it away, right? It's hard to do, but I think we have to pivot. I think we have to be flexible. I think you parent one kid one way and you have another kid who's totally different. Parent them a different way. That's okay. Different rules, different kid. It's affecting their sleep.
Yeah.
Right? They're scrolling. They're nonstop on their phones. They're not sleeping as well as they should be. They're not sleeping as long as they should be. They're immature. They're impulsive. Every that you get, we get, the kids get, a post is like a hit of dopamine. It's a drug. And our brains are at least developed. And maybe we have better impulse control and knowledge and understanding of what we're feeling. For them, it is a drug.
Do you put limits? I think that something arbitrary is always tricky. It's like when you have to get 7 to 9 hours of sleep every night, and if you don't, you're doing something wrong. And I think that could be a little dangerous. Is there any arbitrary rule around social media that you think where it's going to negatively impact kids?
I definitely, there's this whole movement, wait until 8th to get a cell phone. I think that's an excellent movement, wait until 8th. That doesn't mean your brain is not fully developed till you're 25. Doesn't mean giving it in high school is a good idea, but I do think waiting through middle school is an excellent idea.
I always tell my clients as adults, shut the machines off an hour and a half before bed. That is to get your brain to come down.
Perfect advice. It's supposed to be 2 hours, but I'm a doctor, mom. So I do have a little bit of reality in me. Mm-hmm. And I think it has to be do what works for you. But we know that this is just nonstop keeping our brain on, our visual systems on, and it's bad for us. So at least an hour, if not 2. That's what the American Academy of Pediatrics says, right? The less on it, the better. Be a kid. Go to your neighbor's house. Catch bugs.
Or play board games or something like that.
Games. Learn how to play card games. Yeah. I am so not perfect, everybody. I'm a pediatrician. I struggle with all of these things.
Dr. Klein, Lisa, my good friend, my new friend, relatively speaking, but always appreciate your generosity. You should follow Turning Teen. Anyone who's watching this, follow Turning Teen on Instagram. She publishes a ton of fantastic content that's meant to educate and destigmatize a lot of the language that we grew up with and that we couldn't really talk about. And she's here for all of the questions. She's not going to talk about politics or religion, but she's going to talk about all those other uncomfortable topics so that this way you're in a good place to have a good conversation with your kids. So, Lisa, thank you so much for your generosity, and I love it. And all right,
all my followers, go follow Jill at Just Go Long. Yeah. Because she has so many things she's teaching me.
I appreciate that. All right, folks.
Okay.
Have a great one.
Thanks.
See ya.